And we are continuing our coverage tonight on teen mental health. As the new school year starts back up, the fall season can be hard on students. However, here in Tulsa, there is new help for those who are struggling. Tonight, 2 News Oklahoma's Shea Smith brings us inside the state's only youth crisis center to see how it's helped some of the most vulnerable Tulsans.
We told you about Yes Tulsa when it first opened in December, and people at Yes Tulsa say the family-style model of crisis intervention is what helps them give unique, tailored care to every child in need. And it's the only urgent youth crisis center in the entire state. Solmaz Balut has worked in the mental health profession for 20 years.
Having desire to be able to, just like other professionals that want to help people.
Balut is the program director at Youth Evaluation Services Tulsa. Yes Tulsa has the only urgent youth crisis center in the state, along with a calm center. Parents or guardians can bring their child who needs mental health help to the center, where there's a nurse, a therapist, and a family provider. There, they'll get services and can stay there for up to 24 hours.
It's almost like we are serving a wraparound services when the parents and the child, when they came here, trying to identify what's the real issue here, how we can help, how we can guide.
She says over the past couple of years, the need for mental health services among the youth has increased dramatically, specifically 12 to 14-year-olds. Most of the youth coming in are struggling with anxiety and depression.
Teenagers, they are going significant changes. It's very difficult for them to be able to even like regulate their feelings, their emotions.
And the need for services shows. Since opening in January 2022, Yes Tulsa has helped 545 youth and their families. Last August, the organization helped 15 children needing youth crisis care. This August, the organization has already helped 37. However, the program director says addressing the family is just as important as helping the child.
We are looking at as a whole family, what we need to do, we are trying to identify the problem here, and we are trying to educate the parents and families what they can do.
She also says 81% of the children and families they help are placed with outpatient services, and every family leaves with a plan for the child, and the crisis center will check back in with them 6 months later. Now, the Crisis Center accepts most insurances, but if you do not have insurance, you can still show up. They will not turn you away, and they say they will work with parents on pricing. Now, the center is open 24/7. You can walk in or you can call. In studio, Shea Smith, 2 News Oklahoma.